allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Gosh, by the time I get out of the chair.
All right, we got 5 out of 5. So we have a quorum. Certification of delivery of official notices of meetings was handled by Adam Lickey.
Yep.
All right, moving on to 3.0 minutes. Did everyone have a chance to review the regular meeting minutes for January 17th? Any questions, clarifications, comments, etc.? I think that they were revised,
They
right?
were.
Yeah.
Yeah, I just wanted to thank Gina for always being on top of it with the minutes and all of the reports.
She's a peach.
She's wonderful.
There's
She's
no way to
great.
describe
I know.
her.
Yeah, I send her frequent emails too because
Oh,
I'm
good.
I'm impressed every month by how detailed they are, how
Yeah.
accurate they are, and it's been a big change since a year ago.
Yeah, she's wonderful.
So
She really is.
It's been a
I agree.
very very nice change. It
Yes.
makes our job easy.
She would have abstained that week.
Is there a motion to approve the minutes for the regular meeting of January 17th, 2024?
So moved.
Second.
Okay, that was a motion. Adam, are you recording? Sorry.
I can write down.
They have it on there.
Okay, okay.
Motion.
So it's a motion by Ms.
Lynn?
Roman, and the second was Dr. Rude.
Yes.
Yes.
Any discussion? All in favor?
Aye.
Opposed? Abstentions? Motion carries. The minutes are approved. Moving on to the Health District staff reports. First, we have population health.
No additional items, unless anybody has any questions.
Okay. No, I did not have it.
No, I didn't either. Okay, anything else? Questions, comments? Nope. All right, moving on, environmental health report.
So Mr. Lark, I actually had to task him with something. Him and I were at Geauga Trumbull Solid Waste District meeting today, and I had tasked him with doing something else, so he may be on his way back.
Okay.
Couple things I want to go over before I ask Mr. Hellinger stuff, but behind you guys is
Do we want to push this back to see if Dan comes back? It's up to you. We can go forward. I just wondered.
we can go for it. If he comes in, I'll have him
Okay.
roundhouse anything he has any questions
Okay.
on. So what we did is, for all of you guys that remember last time we talked about the Parkman wells and be able to track like which ones did everything. We worked with Allison from planning, and we were able to make an interactive map, so we'll have a link to this that we can send out to everybody. And what it does is it tracks, because it's all public information. So on this side you have what everything means. You have the salt dome being the blue, the light blue turquoise dot. New well is in green, a yellow is a low chloride level, and a red is a letter, so they didn't want a new well or didn't respond. And so if we zoom in here, so if you were to click on I'm just gonna click on a house here. But if you were to click on the house, it will, there you go. I can't use my mouse. So to tell you the status, new well drilled, the results were 280, 200 was, 150, 200 is what we're looking at. And then you can go over all these, and if it's like a letter, so I'm just gonna go to a red one. A letter was issued, results were 0 because they never allowed us on their property, we need to get a sample. So this will kind of give you Parkman wells and Parkman Township in general, that area that the wells were done. The blue dot, turquoise dot, obviously is the salt dome, so it kind of shows you. As you can see, these were kind of hit and miss. Like there's a number of yellow ones between the green ones that were no issues.
Yeah.
That could be well depth, it could be casing depth, water flow could be luck.
Yeah.
So there's a lot of things in there. And there's a number of red ones where they just said don't test, either don't test my well or they just didn't respond to us in general.
How much did that number, do you have any idea?
How many red ones?
Yeah.
2, 3, 4, 5, 6,
This-
7, 8, 9, 10. Let's say
Alright, so
11.
this is accurate.
That's counting. My idea is me counting them right here.
Alright, that's an accurate picture then of,
Yeah.
okay.
Yeah, so that is everybody that we had, and it was nice because Allison was able to help out our team do this, where now you can, if you ever need it, we can just come up, pull it up, and people can check it out.
That's nice.
That's a really good visual.
It
But
is.
it is interesting to see.
You would think you'd have like a big hotspot, right?
Yeah,
You'd have like the dome, and you'd have
right.
a bunch. It's not, and that could be
Yeah.
casing depth, it could be a plethora of issues, or factors, I should say, factors. So anyways, that's that. I just wanted to let you guys have it because we talked about doing this before, and the
Yeah.
original we had was like just a plot map on a piece of paper. It's hard to read. This we'll be able to send out as actual data that has that you can just click on.
So
And
the
I
only
think-
thing,
I was just gonna say, I think it's interesting that the red ones happen to be on one corridor, they're not like scattered.
It-
Well, if
It
you
is
consider
funny.
the green word, yeah.
We did do multiple attempts, and we include one sanitarian going out at 5 and 6 o'clock at night and went home and asking, so we did try.
So my only suggestion,
Yep.
Adam, is like when you click on a parcel and it shows you the chloride level, correct?
Mhm.
Now, that is pre-digging of new well.
Correct, yeah,
So
that's
can we
whatever the result was.
Specify that, cause I only couldn't, like, if I were to look at this and have no context, if I pulled this up, I would say, why do the green ones have a chloride level that's really high, but they're green?
I gotcha.
You know, just like a legend
So
of
these
some
are, I
sort
think,
that
in
designates.
draft still, I think
Yeah.
they try to finish them up. as
Yeah, I think that's a
quickly
good
as-
idea. Okay,
We could,
just-
that's a great point.
We could change that.
Yeah, just like,
We could do like new,
Yeah, 'cause
cause we
it's-
did a test, I think, on all of them after, so we'd have the after, we'd do before and after, something like that.
Oh,
yeah,
that'd be
and, I
good.
mean, yeah, if you
That'd
have
be
that,
good.
that'd be great, but I think
Yeah.
just
Yeah,
to
I mean, I don't even think you need
designate,
the after.
no,
You
just
just
to
need-
say it was this,
Yeah.
not
Yeah.
this is what
Oh,
it is and it's
yeah, so the
green.
reason that we had the original ones on there was to show how high some of them were, cause there
Yeah,
are
and
some
I
in the
like
1500s.
that, but I don't think that
Wow.
it makes
Yeah, it was really high.
sense.
Yeah, I think they plan on putting a date with it,
Okay.
of testing results, and also what I think is nice about this is the homeowners that have, or send a letter but not tested, somebody
Yeah.
buying the home now can go, oh, we can keep track of that better.
Yeah.
And we, the new transfers property, that we go out there and, you know, offer that, have it tested
That's a
again,
good
we
point.
should be.
Yeah.
Well, I think the other
Offering
thing
that.
that might be helpful is the ones that have been redone, that border a red
I
one,
don't know where the 15
they might
was.
benefit from knowing the results of their
But
neighbor.
retest all of them.
I think it was my first integration with GIS with the county data, which is what we do all the time, so.
Cause it,
should be
it
better.
might be interesting, the one that tested low, some of them turn up high,
Yeah.
this is far out.
Why somebody would not want to have their property tested
Fear.
boggles my mind.
Yeah, I mean, we,
Michigan.
you never know. And I think the total for all these wells was like off the top of my head, I wanna say it was like 730,000 for all the wells, off the top of my head. I think that's about how much we paid Donmark, how EPA reimbursed us for.
Okay.
Okay, so I'm just writing a note to myself. Alright, and then, and on the back of the sheet, for those that, everybody has it, it is the results in the back too, because obviously you can't click on yours and
Yeah.
bring it up. And then also, we have, one second, I'm gonna disconnect this just so I get my email real quick. We also have,
We wanna look at your email.
right, with my luck, it'd be something hip and then I get yelled at.
What is,
Brian will be over here trying to sue me next,
the
so.
low level chloride, what makes it high, what number?
I believe that was 200,
Okay,
is what our sample was for. Alright, let me get this to connect one more second here.
Do you know which one is the highest looks like the 1453?
Yeah, that should be the highest. There was a couple 13s, if I remember correctly. Yeah, 13s
Where
are
is
towards the
that?
bottom.
Where is that on the map?
Yeah, that's a good question.
Smith would be, or sorry, Madison Road.
Isn't that,
Let's see here. Yeah, they should be up on,
main road that is, right?
you know what, this isn't letting me do, it's probably the connection right now. I can't make it expand to do the new,
I mean, I could pull it now.
Yeah, once it's finished, I think all that information will be on there, absolutely.
here's a 13, because they were mostly.
Is this going on the website then?
We'll have a link to it where the public can look at it.
Yeah.
So is there a pattern of the highest levels in,
Doesn't seem to be, cause I think.
yeah,
There was not.
This is like
I
very
don't think we
random.
even can say for certain because we have so many still out there that
Yeah.
didn't respond. I wish from that standpoint, we did have that data,
Yeah.
you know?
Yeah, because some of the stuff was, we had houses that were like right next to the salt dome that weren't that bad. We had
Right.
houses that were right next to it that were 1,300. So it was not, there
Elevation,
wasn't,
topography should be added and really take a look at it.
logically speaking, we all expected to be like, almost like a stream that would go down and they'd all be red, or they'd all be like nude wells, and then you'd have everything on the outside that would, and that was not the case. We found them kind of splotched all over.
Yeah.
But again, that goes to casing depth, how the well was drilled. I mean, it could be, the pattern could be how it was drilled versus newer ones. So
Has Ohio EPA asked for that data?
we provided it a long time ago, yeah.
Yeah, they should wanna look at that themselves.
do we have that information of those factors at the time of testing with the wells, depth and all that?
The new wells,
No,
the previous.
previous,
Yeah,
what they were,
if there's data, yes. So here, all the results are on here, which are on the back of this. And then the new results, we have those as well, they're just not on here, but we do have the new results also.
no, I mean, the
If there's
the
a trend.
information as far as depth,
Oh, not always, no. cause it's not, either A, it could've been old enough, or B, it's incorrect, which we did find some that was just plainly incorrect.
Okay.
So, yes and no, it's a mixture. Next, the thing that we want to do, this is a report we'll have right at the HDAC for everybody. This is going to be partially that other handout, which I don't have any more left, but it's the one that has all the colors on it.
Oh, yeah.
This one.
Yep.
So one thing I wanted Dan to do was to look at septic systems in Geauga County and see where our failure rates are historically. This also looked at the for sale property program as another thing we looked at. So the full report will be at the HDAC meeting because we're not done with all the little things we wanted to, we switched some stuff actually today. But what we did is we took a statistically relevant sample based on a bunch of different factors. And we found is 41% of the systems had failed their inspections when they were inspected over a 20-year time. So I think it was, or sorry, 20, it was 2022 was our sample period. Pass was 144, and then no inspection, that is for multiple reasons, were 97. Some of the no reasons were, we actually never followed up with them. So we did everything and then just stopped following up. But the state average for that time period was 38%, if I remember correctly. So we're really close to the state average. It wasn't like we're 90% and they were 30, or we're 30 and they're 90, within reason. And then of that 144, the reason for the not inspected were anything from no data, so we had nothing on it, to new construction, which would have meant a new system went in and they were putting a new system when they put a new house in, probably more of a new house. Other, which is a bunch of different factors that we can find. Vacant, if a house is vacant, we can't test the system because it has to have flowing water for a set period of time. And then a program end or backlog, those were ones that we ended the program. If they were in the mix and we said, hey, we ended the program, that was those. But nonetheless, going back, one thing I have heard before, I had someone tell me again, is that the previously 10, 15 years ago, they were told there's never been a failing septic system in Geauga County. That's not correct. I've had to rebut that many times. Berkshire States knows that, if nobody else.
Yeah.
But so this was, we'll have a full report at the HDAC meeting coming up on March 13th. But we still wanted to, we were hoping to have it ready for your guys' meeting tonight, but there was enough data points that we still didn't feel comfortable rolling out the whole thing. So this will be out in full force at the HDAC for everybody. It'll be on the Board of Health, or the Facebook page as well after that.
Very good.
All right, and then, so besides that, Mr. Hellinger. So Mr. Hellinger contacted myself and Mr. Lark a week ago or two.
Tuesday, 22.
Tuesday, 22. Okay, so he contacted us. He had an issue that came up. We did invite him in to come in to speak if he would like to. He is. If you're not opposed to it, given this a current issue that we are looking into, I wouldn't really put this in public comment because it's more of an actual issue that we're dealing with from our side. So if you guys would let him, he had about 5 minutes and 15 seconds.
It started in 2006, so it's not that.
Yeah, yeah. Well, my understanding is you were, I don't want to say ignored, but
Okay,
it was not addressed back then.
okay.
So, would the board be admissible through hearing?
Yes.
Okay,
Absolutely.
all right.
Absolutely.
Come on up, sir.
My practice presentation was 5 minutes, so we'll see how I do this.
All right.
I'm Wes Helligers. I live on Butternut Road, 14481. We're grateful for the opportunity to share with you. This has been going on with Kaufman's dumping 3,500 gallons of sewage, human waste, feces on big trucks like this. He started out with one truck at 1.65 acres with Bob Weisdeck. Weisdeck approved it to go up to 6 acres. Then Tom Quaid, before he was fired, he approved it up to 22 acres. And this is a map, if you want. I got copies of all this. It's on electronic. If you give me your email, I'll send my electronic 52-page file for 17 years of work. But it's very close. I mean, it's 150 feet from the Amish school. This new one that went in, it's called Butternut Acres. There's 50 kids go there. Now there's another school that's 150 feet from the dump site. The Meadow Glen School, I think that's the name of it, is on Clarendon Troy Road, and anyway, that's like 1,000 feet away. And I talked with Dan and Miriam, my neighbors, Miller, Amish gal and husband. They recommend that they would not come here tonight. their procedure for expressing their opinion of the dumping in their backyard. You have Dan approach them and said, we'd like to hear your side of the story. Then they can comment. But they'd like Dan, or you, Adam, to contact the presidents of the schools, and all the Amish schools have presidents, and like 3 members, the kids that go to their school, they're the elders or whatever that help run the school. And they will express to you their adamancy, they want this stopped. But they gotta do it their way. Okay, so, anyway, the Amish school is a problem also, we all agree. I don't want it in my grandson, in our yard, we're closer than any of these. The problem we have is that you got a new high school now, $50 million special, and we had John Stoddard come up and look and talk to Wisedeck, and Wisedeck said, no, the sunlight will kill all the stuff. Literally, that's what he had told John Stoddard, superintendent of our brand new Berkshire Community School, which is less than 3,000 feet from this dump site. We also have Camp Burton, which is busy in the summer. We also have, the well situation. We're talking about wells, Adam. You know, they're putting like 900,000 gallons a year on this dump site. Now, it could be more. None of us really know how many loads he does, because he dumps them at night, he dumps them whenever he wants to dump them, he dumps them. So, anyway, the odor in the summer is terrible, so I doubt if it can be perfectly treated with hydrated lime, which should kill the odor, but it's gross. Initially, back in 2006, he was a farmer. He had a farm. He no longer farms it. It's 100% commercial dumping on this 22 acres now. There's no crops grown on it.
Who is he?
Gary Kaufman.
Okay.
Kaufman Sewage.
All right.
Yeah.
Who's the farm?
He's
Okay.
one of the, if I'm right, 23 sewage haulers in the county. He's the only one that has this privilege of not taking it to
McFarland.
Bedford or McFarland or, Lake County, the proper place to dispose of the cesspool. Well, actually, they're septic tanks, and nobody knows what goes in a septic tank anymore. Yes, we have human waste is bad. The drugs that go down the toilet are bad. All of the other diseases, who knows what they are? I mean, I probably could look up a list. You could know what is carried in feces, but it wouldn't be pleasant. So, anyway, I'd like the Geauga Health Department with the new group, the new powers that be, shut this thing down. It doesn't belong there. It doesn't meet any of the latest requirements for a dump site. It's not a rural area. It's packed with people. So that's my plea. Please shut down the dump site to save a lot of kids' lives. Any questions, I'll be happy to answer them. And if you have your email and want to see my folder, you're welcome to have a copy.
Maybe you could email it to
Yeah,
Adam.
email it to me, I send everything to him.
You're gonna send everything to them?
Yeah.
How is
Okay.
it zoned? Do you know what the zoning is for the?
Yes,
the
it's
dump
R5, agriculture and residential.
site? Okay.
How he's got approval to do that, we had a zoning meeting, and I have the minutes of that meeting.
Okay,
where-
so you've tried that way already.
Well, it was overturned by Bob Wisedeck.
Oh.
The zoning group back in the day, I don't see Jim Dvorak here, but him and his people said no at the time, and Wisedeck shut him down.
Interesting.
Was it
So-
grandfathered? I mean, I'm trying to think, it would be,
No.
Yeah, what was
grandfather
the-
didn't know.
I wonder what the-
Wait, I've been there since 1973, there was nobody dumping anything there,
Alright,
but,
yeah.
maybe a horse or two,
Okay.
so. Go ahead, sir.
So you brought this issue back to the public health department starting when?
My first plea was in
2006.
2006.
Okay,
Wisedeck would shut it all down. He
Okay.
gave permission to it. He, his argument to me, I'm written up in the newspaper as a bad guy. So, I wasn't true, they were honest about
Okay,
what
so
it was.
2006, and then WISDAC closed it down. When was the next time you brought it?
No, WISDAC did never close it down.
He-
You mean
No, I
shut,
mean-
shut down your
He shut you down.
Yeah,
Yeah.
yeah. I presented the problem to, got a whole list you can see in my emails,
Okay,
all the way to Dave Yost and the governors and,
I
all
think
the
we're-
above.
all right,
Tom
yeah.
Quaid, so that would be probably the last.
Oh, Tom Quaid, yeah,
Visit
But-
of
okay.
administration, I think.
He was very negative, by the way. He got what he deserved. So,
We can't comment on that.
that's where we're at, yeah.
I'll smile about that though.
Okay.
Does this dump have a name? Is it just Kaufman
It's
something?
Kaufman Septic, yeah, he's, here's the side of his truck if you want it.
Yeah.
G.
But-
Kaufman.
And so
It's
he
Kaufman.
seemed like
That's
a,
him.
Kaufman
Yeah, he's-
Septic.
Yeah, he's down on, Frank Road, I think.
Yeah, if,
Yeah.
I would agree. Send everything to Adam,
Yes.
let Adam send it out to us.
Sounds
Dan,
good to
Dan
me.
and I are looking into it, it's just, it's not like a simple yes, no.
Exactly. And when did this resurface with you and Dan?
I think the 22nd, I mean, I was
Okay.
saying it was a week ago, but I.
The thing that, you won't mind, honestly, why I really got, it did nothing for way too long. When they put the new Amish school in there, that just ignited me. I said, you can't be spreading this stuff in these little kids, they don't get vaccinated, they don't get any protection or nothing. So that's what bothered me, I said, these kids are gonna die. We know COVID's in the feces, we know that you have the laundry list, just pick them. Encephalitis, we don't have Ebola here, I hope, but
Usually look at the infectious
Yeah.
disease reports for the Class A reportable and see if there's, for the last 10, 20 years in that area. I mean, that's all data that's available to us, infectious, yeah.
one of my long-term, requests, Ron, was to have all this documentation. You're supposed to have every load's supposed to have a document. Today I dumped 3 loads, okay? I've never been able to get the, test for pathogens on the soil. They've never given me the test for heavy metals. They never give me EPA sewage permits. I never got an NPDE permit, a memo of understanding between the EPA and the Geauga Health Department. I never got any of this.
Yeah, not good. So, yeah, I think absolutely, it sounds as
Well,
multifaceted
you
as
gotta
we legal.
You're getting in it. Tough.
Yeah.
But Ron, are you aware of any precedent?
I have a lot of
either
empathy.
After Parkman Wells, I said no more problems, so I don't know why you're here.
Well, but, that's the interesting thing, there's 4 counties
Are there
in
similar,
Ohio that have said no.
similar things to what he is describing?
Lucas,
either
I've
like-
got a list of them in my
Remember, yeah.
report, and alls it takes
Not
is
that I'm aware of,
the,
but that wouldn't be mine.
Commissioners
But the
to
companies
write a
don't-
letter saying, as of this date,
Yeah.
there's no more dumping of human sewage on a field.
they pass a resolution, is that,
I'll give you the names of the guys
Okay.
that did it, if you want, that got it passed in their counties.
And we have to, so Dan and I haven't gotten to do it yet, we have to go back and look at the minutes to see when this was.
yeah.
I
Because
got,
we don't-
I could shoot of 2006,
If you can send, if you have the minutes, go ahead and send
I
it.
got them with me, yeah.
I don't
Yeah.
remember anything under Quaid's reign.
Yeah.
Oh, no.
Coming here, coming to the board.
Yeah,
I don't,
Did he bring it to the board?
I don't remember hearing
Ms.
this
Roman,
before.
we had, Marcia and I, my wife and I had a meeting with Tom Quaid, and at that time it was Sage, I forget his
Yeah,
first name.
Mr.
David
Sage.
Sage,
Yeah, he's a toughie, and, we came in with our gloves and masks, and he dismissed us out of pocket. There's no problem.
Well, I've been on the board 5 years and I never recall hearing
Yeah.
this issue at all.
And it's not something that we
I was,
have.
that's the first time I've been allowed to come.
Well, welcome.
Yeah.
So,
You're not.
anyway, and we live right on Butternut Road, we're real close. If you wanna come and,
Dan did,
for a visit, you're
Dan went and met with you last week, or this,
yeah, we got on my UTV,
Last week.
went around 22nd,
yeah.
10 in the morning, he was right on time. And we went around, and I took him over to the Amish house of the Millers, Miriam and Dan, and I showed him, Kaufman put up a tacky wooden splash fence in their backyard, the Miller's backyard, because there's so much feces spread all over their pasture. So they put this eyesore fence up to stop the spreading into their pasture.
Did it work?
It's on
Yeah,
windows.
He's got- he-
Unfortunately, we had an issue, I was supposed to go with Dan.
What stops
We
it?
actually had to
What
split up
stops
to
it?
do 2 different meetings, so Dan
Yeah.
went out and met with them.
Yeah, the odors are horrible, especially where the Millers live, it's really bad there, because of the west wind.
Do you think we could go out, so whatever group of us could go out and look at this?
1 or 2 of you could, but not more than that.
Not a
Okay.
quorum,
Yeah.
no quorum.
There's not a lot of
They have enough
law
ulcers.
odors, but definitely infectious agents or heavy metals. I mean,
Yeah. Dan and I will have more information for everybody. Like I said, we just didn't get, I was planning to be there that day and I couldn't because of the
Dr.
meeting.
Mark, I don't think anybody has been there since under the WISDEC regime.
Okay.
We'll visit it.
Yeah.
So not speaking on behalf of the board, but just personally, I'm very
Well, you're
moved.
welcome.
I'm
We
moved by-
got an 85-acre farm, with one room for everybody.
I'm moved by your dedication to this principle of this issue, and we, on the board, I'm sure, are gonna take this very seriously.
Yes.
I've been there since 1973. When I moved in, it was pristine.
Yeah.
I wanna die, I'm 81 now, when I die, I want it pristine when I go.
I don't know.
And your address is 18881 Butternut?
My address or his?
No, yours,
14481,
14481.
yeah. I'll give you a card
Thank
if you
you.
need it.
Thank you
So
very much for
appreciate
sharing.
Due diligence on it, as he said, and be able to look into it with the packet of information.
This is,
Oh, he's gonna give us a tip, that's great.
well, I've got enough for everybody.
No, that's okay.
I think Brian says that's a bribe.
I'm like, you guys are stressing
Oh,
me out,
that's-
that's one of these jokes.
That ulcer's growing.
To ensure prompt service.
Yeah. I'm not sure that's the. He's having ulcers now. He's like, I'm
Let
not
the record
doing this.
show, we accepted no money.
All jokes.
Two keys.
That was
How
just
did
a
we get on
joke.
this?
Let the record reflect.
Okay.
Alright.
Right.
All right.
Thank
So
you.
with
I'll tell you what,
I
let
want to
me
keep
just,
us moving
anybody that wants to
along.
give me their email, give me your,
It's-
we'll just give it to him and.
Yeah.
Yeah,
give it
I'll
to
just
us
send it out to
first.
everyone.
Easier with public record.
Thanks, everybody.
Thank you for
Excellent.
Thank you,
coming in.
thank you
Yeah,
for
thank
coming.
all of you, thanks.
Yeah, we
And your wife as
appreciate you
well.
coming in. Did you have anything else to
Took too
add
much
with the
time.
environmental
Uh,
health report, Adam?
Thank you for
No,
the
I wouldn't
advocacy.
add, unless you guys have any questions, I'm not gonna add much more to that, just so we can keep moving.
I have a question, I mean, this is just me
Uh-oh.
being nosy, not
Alright.
really a board question, but the Target in Bainbridge that had the fire, did they have to throw away their food?
That one, I believe the answer was yes,
Yeah,
and
most
that was
times.
due to the
That's what I
fire,
figured.
the fire system amongst the smoke. Dan and I did talk about
It
that.
still smells stinky in there.
And the shelves are empty.
Yeah.
Yeah, I noticed that too, so that's, I assume,
We typically
like I
cut
said.
this stuff, box it, whatever.
Yeah.
and not go in.
That's my own nosiness more than I
It's a
need to.
disgruntled mother.
Alright, administrators report, Adam.
I'm just hit on a couple things real quick. The state audit was completed, a number of you attended, that was very positive. We had no real issues to speak of, it went very smooth, so we're good on that one. Tomorrow is when our audit for 2023 is due, and they start the audit like 2 weeks later, so we're ending one to begin
Where
another.
ends? It's never ending.
And then the HDAC, just a reminder, that's March 13th at 6:30 p.m. It'll be in the big conference room down there. I am having Manja deliver food, so we'll have that at 5:30 at 6:30 for a meet and greet for those who like to talk and chat. The annual report, which I sent you guys a draft copy of, that'll be hopefully released here at the HDAC. Thank you, sir. Appreciate it.
Thanks for coming in.
Good evening.
That is a requirement that we submit, or that we produce each year. And then the last one says public records. As you're all aware, we did shut down about 2 weeks ago on Friday. We did get through the documents. We submitted them to our legal team for further review and then to send out. It did take 4 to 5 hours for almost everybody for the most part. And then we had to go look for other documents downstairs, which we spent most of the rest of the day organizing downstairs and trying to get that stuff where we could find the additional files that were needed.
And this was all to answer records requests.
Correct. There was anytime, more or less, anytime the word Chardon was mentioned, we had to pull it out, and that was from 2010 until 2024. And to read through all of the minutes was, God bless the team over there, because that's what we spent doing almost the entire day. We still did answer phones, because I didn't feel right not answering phones, given that not everyone saw we were closed.
Yeah.
So we still answered phones and helped the public if it was an emergency. But yeah, that was, unfortunately, I don't think it would have been in a timely manner if I did it myself, because I'm not gonna get through that many minutes anytime soon,
Yeah.
so.
So those old minutes aren't digitized, is that?
They are now, so we had 2012 and 2023.
Just in case this happens
The 2
again.
years that weren't digitized, I had 2 staff go through those minutes, and then we had them scanned and then uploaded. which they have to reset the filter, because now it actually shows those first before everything
I was
else.
gonna say, it's still hard
Yeah.
to search.
2010 to 2011 is now the first. The reason that we couldn't do like, I'm sure the question would be, why didn't you do like Control F, like
Yeah,
Control
well,
find?
that's what I was
That's what we
Right.
just said,
So
yeah.
we didn't know if Chardon is spelled wrong, or if it's abbreviated, or if the address, which in very many times was like 176,
Space.
you know, Mayfield. Well,
Yeah.
where's it at? You don't
Yeah.
see
Right,
it.
right.
If they misspelled Chardon, or if it wasn't a searchable document, you don't
Right.
always know that until you try it, and then it comes up as such. Sorry, I don't think it's really, just because we don't talk. So we did do that, so we did get through most of that for what we had to. And other than that, that's for that public records request. And that's just the one, that was not the other ones that have come through, that is just a single record. The rest of them I generally handle and then hand them off to Mr. Kostura, who follows up the rest of the documentation. So it takes an exorbitant amount of time.
What is our status on public records requests overall?
I don't have a dollar figure right now. Actually, we were trying to prep that, but between the state audit closing out and then this, the septic thing we were trying to get out to you guys, it just did not happen.
In terms of completion of the other
Oh,
ones?
most of them are complete, with the exception of that one, which was just a large file.
Yeah.
Some of them I handle if it's nothing like, if it's not HIPAA and I have no risk of HIPAA, I will send them out. If there's any risk of HIPAA, I usually send Mr. Kostura. But we are getting ones that are calling in and asking things, we get ones that just approach as you're walking through. There was also, in the Chagrin Valley Times, there wasn't a quote by me in the article, which is a little rougher than it sounded, but we did have at a county commissioner meeting, a member of the public stand up and specifically state he saw only 2 members of GPH working, and that's all that worked. At which point I offered a tour of our space after the commissioner's meeting, which he was taken up on. Mr. Lennon took me up on it, and another gentleman. We walked through the space, there was probably 15-ish people back there at that time, after the sanitarians already left for the day. It didn't change that person's mind one bit, changed the subject instead. But it was a frustration from the staff, because the staff then heard,
Yeah.
there's only 2 of us working, and that didn't sit well with them either, that now they're being told they're not
Right.
working while they're working.
Right.
Which is a frustration. It's tough when you're doing your job and you get slapped in the face with, you don't do your job.
Yep.
So we have those as well. And again, I just said it was falsehoods as it was presented, and we corrected that.
So how many records requests do we have out here?
More than a dozen, I want to say,
And
with
they're
all the individual ones. I mean, it's somebody lumped together. If it's one person, and I give them 5 days, I may say it's one. But I say if you spread them all out, it's more than a dozen.
One person's made these 12 requests, or more than one?
Yeah, one person I think had 8 or 10, something like that. With different, like, different days calling, different requests, emails, texts, calls, all those together.
Yes.
It adds up
Okay.
a little bit,
Okay.
yeah, so.
It sure does.
So
Oh.
I think Mr. Kostura wanted to add something.
And I can offer, as GPH staff did a great job of going through all of the minutes that was part of the last records request. As part of the initial records request, there was, part of it stated that it wanted all financial records, including receipts, fees, charges. We have gone through all of that, and that was sent out last Friday. That was over 8,000 pages of receipts and charges from, I think, 2010 on.
8,000 pages?
8,000 pages that we
It was
provided.
digital, so we didn't charge for it, we can't.
Yeah.
All right, that was good.
As of Friday, those went out. And Adam's team, like I said, they did a great job of getting me all of the minutes that they've gone through. But as frankly, for being complete, we need to go through it as the legal team, because we need to make sure that there's nothing in those minutes. And we have to provide nothing in those minutes that we should be providing, which is never the case when it's a minute, because it's an open document, but that it's responsive. And unfortunately, a lot of the documents that were initially pulled, they all say Chardon address at the top.
Right, that
And
was
so we have to go
thought.
through to make sure that they're responsive, because as people were going through, they saw Chardon and they would just put it aside.
Mhm.
Well, that's not responsive, and so we can't just give it to you, because that's
Yeah.
not what you've been asked for. And so we're going through it as a team and pulling out all of those things that are responsive, and then, being able to sift through it and make sure that Geauga Public Health is doing what it's supposed to do when it's supposed to do it. So, we haven't been able to get out that next set yet, but that is in the process.
I immediately thought that our old address was Chardon, so any
It was.
letterhead, anything
Yes.
was going to
I-
have that on
It's
there.
exactly
so-
what I'm going for.
I literally even told everyone, don't highlight our address, and we still had a couple that highlighted the address, put it in the pile.
We're talking
And-
lots and we're hundreds of pages right now
Yeah.
of
Yes.
addresses that say Chardon.
Better to initially be over-inclusive.
Well, and that's, we acted as the first primary filter,
Yeah.
and then we filtered down for Mr. Sure to go past there.
And we've been going much faster because I went out initially a couple of weeks ago and started going through the minutes in the basement, and we were able to start pulling things together, but it's a very slow process. And if he didn't have 15 people doing it for an entire day, I don't know, that this could have gone on for months. So I think we'll have this wrapped up within the next couple of weeks.
Thank you.
We're very appreciative of all the staff,
Yes.
for being cooperative.
We appreciate the
Yeah.
donuts, I'm just saying.
It's, but you know, I mean, this is an unfortunate distraction for
Yeah.
the health department trying to accomplish
There-
important work.
There was a question, I think, by one of the papers is, so does that mean you, no inspections, brought in no money, served no public? And the answer is yes.
Yes.
Yep.
It was not something we wanted to do, but after discussion, it was the only way to do it. They got this out in a reasonable time and manner and didn't cost an arm or leg. So that was our best
Well,
option.
it costs an arm and a
Yeah,
leg
it still
in ter-
costs, just.
in terms of
Yeah,
serving the
it's
rest
more of a
of the
static
public.
cost versus a fluctuating, so.
Personnel resource cost. not
Personnel resource.
Yeah,
financial-
lack of
financial.
All for basically one person surplus.
Correct. We are nothing but transparent, so we did, you know.
Yeah.
Jump out.
And we certainly.
I'd like to send a bill.
Yeah.
But in the future, hopefully they're available on the website or archived as we convert records and make it a little bit easier.
Yeah, and I do know, because Mr. Roman and I talked about this, there were numerous people that asked me, were you billing them $10,000, $15,000? For those that don't know, per the law, you cannot charge those things other than if it's the cost to make a copy, cost to ship, a USB drive if they want it that way, but this is all via Dropbox or something similar. So, not that we would charge, but we couldn't even say like, hey, it's $5 for, you know, $5,000 at the time, it's just, it's not even a cost. So, it is a frustration, but, you know, we do what we have to do.
Well, I appreciate everyone's being very professional, taking care of it, and hopefully, some of those distractions will come to an end shortly. Any other questions on the administrator's report?
Just under the section notes to financial statements, I'm going to assume it's a typo in the very last sentence. This is the 12th month of the year and contract services is significantly over budget due to timing and pay.
Yes, that is
Contract.
that was a holdover from December.
So that should have been
I
23.
apologize, yeah.
Okay.
Usually I do read all this before it goes out.
Yeah, that's
and
okay, just checking
this
myself
time I
too.
didn't ask it.
What page?
Let's flick to, I think, yeah, I don't think
There's
there's
no
enough.
page number.
4.03.02.
Two.
Yeah,
You guys
I
keep us
got
in
it.
line, that's a good thing.
Okay, moving on to the health commissioner's report.
Nothing major, there's no question about the content that was provided. The main thing is we are waiting on the Public Health Accreditation Board to do our, review the annual report. And because of all the changes and disclosures and the building change and potentially another building change, there's gonna be some special status that Geauga will have to address and answer their questions. And I think that we're gonna limp along through that till the next reaccreditation period, which is about two and a half more years from now. I did provide you with new business on the overdose death and suicides. So typically that has been able to be managed by public health. There was no criteria on shall give data or may give data under the code of federal regulations, but Lake County's been approached to host that and start that committee, so one and offering the same opportunity for Geauga, certainly the numbers are much lower, which is a good thing. You can see this age adjusted, but one loss is too many. So we're hoping if you want to vote to create that committee, we do it unanimously. I would take it to the county commissioners. Our legal team in Lake will be drafting up policies on handling the records, conducting those. We do the same, so it saves us quite a bit of money from that standpoint. The protocol will be the same. And then I would talk to likely the Adams Alcohol, Drug, Mental Health Services Board, Child and Family Services, kind of the key committee. Make sure they're buy-in and then we proceed with that. Time-wise, it's a little bit intensive, but we do have the epidemiologist. I probably lead the committees of the review, and then if there's a select board member or other experts that we can ask.
I would be more than happy to volunteer for that, just being involved with Project Dawn, so.
Yeah, everybody usually wants to get down there, so it's
Yeah.
stuff, but yeah, we certainly can structure that and and, so they don't form with the board, we're good to do that, so appreciate your
Keep us
interest.
posted.
So where do we vote for that? Okay, that's under new business.
Yeah.
Alright, just wanted to make sure we weren't supposed to do that now.
6.3.
Okay, any questions on health commissioner report, the opiate, board?
No, I just always appreciate Ron providing a lot of interesting information for us.
It keeps us up to date in a
Yeah.
concise way on
Yeah.
all the happenings. I like that.
Glad you read it.
Yeah, and as I
Like
shared
it.
with you earlier, the facts about Ohio tobacco and nicotine usage just blew me away.
Yeah, so we're trying to look at some more innovative ways to do that, actually just start thinking about, if you're donating a pack of cigarettes that are unopened and you're trying to quit, maybe get passed to a Rexon or the YMCA, so we're kind of looking at how do we get people that wanna quit, but oftentimes it's money, weight, or, physical activity, so like they gain weight, so nutrition.
Yeah.
So seeing how we can bring in some of the nonprofits and even for-profits to do something kind of flashy and good for the community, so I'll run that past you as we formulate that program thought.
Neat.
Thank you.
Great, thank you. Moving on to old business, rent discussion.
Still an ongoing discussion, obviously, the county commissioners did ask for a opinion from the prosecutor's office based on if we're a general health district or a combined health department. So that's still ongoing, it's in the prosecutor's hands right now. Other than that, we still plan for what we can plan for, because we don't know right now.
Okay. Any discussion on that? We're good? Okay. Just grunts, I'll take it. Alright,
Audible grunting.
Audible
Amendments.
Yeah, please reflect in the minutes that there is
Audible
audible grunting coming from the board. I think it was an unanimous grunt.
Roll call.
Roll call. Affirmative with a grunt. Alright, new business, moving on to our resolutions, we need to approve the financials. So is there a, motion to approve the financial report?
I so moved.
Second.
Motion by Dr. Hendrickson, second by Dr. Root. Any questions on the financials? Lynn, go ahead. I know you do. I do too, go ahead. It's fine. You go first.
The Lake County Health District, never mind, that one I figured out.
I didn't figure it out. Were you gonna ask what the time period was for that?
No, I just figured it's
I was gonna ask that for the Lake Health.
the 259
Yeah,
days.
just like the 260, what time period does that cover?
That one should have been.
Oh, so this must be the 9th month of the contract, 8th month, 7th month, is that why it says that 4, 5, 6, 7, is that right?
No, what it is, so, Ms. Brakey signs them. We break up the bills based on how the contract was done, so we do other expenses its own line,
Okay,
management, non-management, frontline staff, things like that. If I had, I believe, I'll pull up the invoices so I can check them. But they were, I wanna say that was 2 months,
okay,
is what it looks like.
okay, so just
Okay.
working out, that's what I was trying to
It looks like
figure out.
contract 4 is probably 1 month, and the rest were a second month. So contract like -4, I'll double check though, I just don't have each invoice memorized.
Okay, and then the McDonald Hopkins was for the record request,
It's for multiple services that we've done, not just records requests.
okay, and then the one, State of Ohio, the 21,000.
Do you know which,
It's
Third
on page
Oh,
third,
yeah.
page 3 of 3.
page 3 of 3, remit, that should be vital stats, I believe, that's the portion the state gets from us.
Okay.
By far the ball,
How much do we get to keep of that?
not a whole lot as you'd expect.
So how do we pay for that employee?
Well, we get enough to cover, but the state always says we get our money back in other services, which,
We have the
Oh,
subsidy.
we do?
with you guys.
yeah,
Okay.
I'd love to see it, I
Yeah.
haven't seen it
I
yet.
need
I
to
didn't know
back
that.
okay.
Alright, so any other questions on that? Oh, the only other thing I flagged was the Ferris excavating,
How much was that one?
14,000.
That would be a WPCL,
That's what I
Water Pollution
figured.
Control
Alright.
Loan Fund.
Just wanted to confirm. Alright, good on the financials, roll call, wait a minute, we had a first and a second,
You did,
right?
Dr.
And then
Henderson, Dr.
discussion,
Root.
okay,
Yep.
and now we'll do, roll call vote.
Dr. Henderson,
Yay.
Dr. Root,
Yes.
Ms. Roman,
Yes.
Ms. Jones,
Yes.
Ms. Brady.
Yes. Motion carries, give me 1 second guys while I fill out this paper. You can go into the next thing if you want.
So the next one is authorization, or sorry, it's the increase and decrease, which is this guy right here. It's the increase and decrease, and this is to increase to have the ability to increase the PO, which is to pay out the House Bill 110 money. Mr. Geauga, and his team got through, we had to, so we can now pay that money out. Longer than expected, yes, but going through as many records as we did, and as incomplete as they were, it's not as easy as just saying, pay line $7. It's more in depth than that. Would you speak to any of that, Mr.?
If you'd like me to explain?
Yes.
So, when we pulled all the records from your 3 different systems, if you guys remember when I put together that report for you, it was based on addresses, because that's the only way that your systems actually categorized anything. Well, the problem is you can't pay an address. So now you have to go back for as many years as we did this, to go back and identify, well, who was at that address from that period of time to that period of time. So we went through the 581 addresses, I believe, and there might be 4 different people that have been in that address over 2012 through 2020, at this point 23. And so we had to identify them and then put them into the chart, which was not how we maintain records here at Geauga Public Health. So although it was a tedious process in the beginning to find which addresses we didn't conduct the investigations or the inspections on, it was even more tedious to try to find, well, who was a resident there at the time. And so although this has taken a great amount of time, we're sorry for that, but ultimately you now can look back at our report and identify where you've had people for each of those years in each of those addresses, and hopefully you'll be able to use that information when updating your systems.
That's helpful.
That's why I said when it was asked, is that not Hopkins, is that just for public records? The answer is no, because it's not public record, but it was part of it. So we need to yeah. So this
Thank you.
appropriations increase decrease is to increase that so that we can then pay that bill out, because the PO got closed out last year, so we opened a new one for this year.
That makes sense. So when are these checks going out? I'm sorry if I missed that.
So Adam and I are supposed to have a meeting with the settlement administrator this week.
Okay.
They have all the information now, they have all the frequently asked questions, they have the notice letters. Now they just need final confirmation on, frankly, getting the money.
Okay.
And the dates that the check is gonna be posted, because what will happen is that I believe GPH has to request the money to be sent from the auditor's office through by wire to them, or I'm not sure if it's gonna be wire or check, but in any event, it's gotta be sent to the administrator, then parses it all out, and then is going to send us basically what looks like an example of what the letter and check will look like, because what we've done is to conserve the fees, because this is gonna go out by mail. So, there's 481 different addresses and close to 600 different people that this is going to. And so there's mail charges for each one of those. So what we've tried to do to decrease the costs for GPH is to consolidate everything into one mailing. So it'll have an explanation of why you're getting this, and it'll have the check included in that. Otherwise, it was gonna have to be 2, maybe 3 mailings with explanations, frequently asked questions, and the check. And so we consolidated it all, and that's how we plan to move forward, just to save everybody some money.
Okay.
We appreciate that. Geauga, everybody.
So it should be soon?
Should be soon.
Okay. So is there, what do I need to do for this?
We do have to yeas and nays, and then sign.
Okay.
So we haven't got the first and second yet.
But what do I have to do as far as what do you need for the motion?
It would just be the permission to approve appropriations for increase, decrease.
That's that we don't need to say
Yeah.
for contract services and the amount of?
You don't have to, no.
Okay.
Just that's presented, because it goes in the
Okay.
packet.
All right, very good. So is there a motion to approve appropriations for increase, decrease as presented?
So moved.
Motion by Dr. Root, is there a second?
Second,
Second by Dr. Hendrickson, roll call vote.
Dr. Henderson,
yes.
Dr. Root,
Yes.
Ms. Roman,
Yes.
Ms. Jones,
Abstain.
Ms. Brady.
Yes. Sorry, I got so confused with the abstention.
Sorry, it threw me, I know.
Threw me off my game.
Start over.
All
So
right.
it was Dr. Rude, you
That,
motioned, okay.
That
You
motion
seconded?
carried. All right, so that is good. Moving on to the then and now purchase order for McDonald Hopkins not to exceed $500.
So, the next three are then and nows. With the change of the year and dealing with some records requests amongst other things, we did not get the budget updated as soon as we would have liked to, and so these were known expenditures. We just didn't get the budget up to date with the auditor's office enough to actually pay them without a then and now.
Okay, so
So-
these are from last year?
Correct. These are expenses that are
Okay.
primarily related to either last year or in January when a PO was not open.
All right, so is there a motion to adopt resolution 2024-1 to authorize the payment of the then and now purchase order to McDonald Hopkins, total not to exceed $500?
So moved.
Second.
Okay, motion by Dr. Rude, second by Dr. Jones. Is this an all in favor or roll call?
Let's just do a roll call.
Okay.
So then,
Yes.
Dr. Henderson, Dr. Rude,
Yes.
Ms. Jones?
Yes.
Ms.
Oh,
Sorry.
tricky.
I should have looked at Ms. Roman. Ms.
Yes.
Jones,
I will say my own yes.
Ms. Brakey.
Yes.
I don't look
Yeah, I
up
was
one time
confused.
and I already screwed up.
I'm very
We
flattered.
try to keep things fun here in the
Yeah, you
Board of
do.
Health. Okay, so,
So when you go back, make sure you tell your classmates, this is the place to be Wednesday at
This is-
5 o'clock.
this is, we keep it
That's
spicy
turning red over there, man.
on our then and now resolutions. Is there, is this for the last one?
That's for the one you just did.
We just did, okay, so this
Okay.
was Dr. Rude and Dr. Jones, is that right?
Right.
McDonald.
Correct.
Okay. Sorry, and this will come down.
Oh, I'm so sorry.
I called in Ashley one time and the whole thing fell apart.
Sticks.
All right, is there a motion to adopt resolution 2024? This says -1 again, but I bet this means -2. Okay, is there a motion to adopt resolution 2024-2 to authorize the payment of the then and now purchase order to Expert IT LLC not to exceed $7,200?
So moved.
Second.
No, dash two.
Yeah, well, no, it's here, it was wrong.
Oh, it's down
Okay.
there, sorry, must be
Dr.
copy and
Ruben.
paste.
Yep.
Yeah, so
Okay,
this is
sorry.
for our Office 365s for the
Okay,
whole health
that's what-
department.
Okay.
It's just renewing those licenses.
So that was Dr. Rude made the motion and,
Roman second.
okay, Ms. Roman seconded, got it. Let's do a roll call vote. Adam?
Dr. Henderson?
Yes.
Dr. Rude?
Yes.
Ms. Roman?
Yes.
Ms. Jones?
Yes.
Ms. Brakey?
Yes.
I'm gonna start switching them up and just see what happens.
No, please.
Rose is off our game.
Okay.
Yeah, that was quick.
All
So
right.
exciting on Lynn's line.
And last but not least, the favorite part, to then and now. All right, is there a motion to accept resolution 2024-3 to authorize the payment of a then and now purchase order to Lake County General Health District, total not to exceed $99,582.56?
I so moved.
Second.
Okay, motion by Dr. Hendrickson,
And
second by
this
Dr.
is this is
Rude.
December's bill that we didn't have the PO open, that we closed out the PO and we still had a bill remaining. So
Okay.
that is our fault.
All right, let's roll call this, Adam.
All right, so Dr. Henderson,
Yes.
Dr. Rude,
Yes.
Ms. Roman,
Yes.
Ms. Jones,
Yes.
Ms. Brakey.
Yes.
And for those that did see the notice I sent out, in line with this, the contract was under budget by $13,000 end of December. And so we're actually under budget what we thought we would be. And that was the most conservative budget, which did not include, like the realistic, what health insurance would be.
Yeah.
So we're under budget significantly more than 13,000.
Because when we budgeted, we looked at everybody as a single
Single health insurance.
person for health insurance, which, okay.
So we're,
So we're under budget by 13K, you said?
just for the most conservative budget, yeah.
Look at
So
you.
significantly more than that if you do what would have been realistically.
All right, great job.
Thank you.
All right, so you want to talk about the budget now, Adam?
Yeah, so I did send the budget out to everyone in advance. Again, this is 2025's budget, so this is what we know today, projecting for 2025. It is one that we change every year in November, December every year, we re-update it when the year's about to start, because obviously everything is different with grants, contracts, almost everything. We do need this to be approved this month though, as we take it to the HDAC, which is next month. It also goes to the county,
Budget commission.
Budget Commission, thank you, I have it written down, I still forgot. Budget Commission for their approval. It then gets put in place for 2025 for tax assessments and everything else, which we do get our levy dollars. We are still positive, we're still doing well. It's just the reality of, there's a lot of increases to a lot of things. I mean, we all know everything is increased in cost.
Yep.
So we're still just being as tight as we can on budget-wise, with everything we do.
Okay.
And I have a question.
Mhm.
What if this 25 budget is not, I mean, it just goes sideways? How does that get changed?
Yeah, so November and December of each year,
Is that when
we re-vote on it. This is really, I don't wanna say use the word pie in the sky, but it's kind of right now, what would I think 25 would look like? When reality is, we're still 9 months away, I don't really know what
It's almost
25
like
looks like.
That's right.
conceptual.
I just wanted to make
just a
sure.
draft of what
Yeah.
it is.
Yeah.
If
We
it's
just have a hard
approved,
time
I think-
approving something that we know could,
Very theoretical.
Yeah,
Yeah.
theoretically.
We try to be as close as we can, because, I mean, I still want that to hold when you guys vote on the next one, and usually they are very close.
Yes,
But
they
when
have
we get a
been.
new grant, it throws off entire funds,
Yeah.
because that fund might be $1,000 in it, and we get one grant that's worth 100 million, and it goes up to 100 million.
Yeah.
Never happens, but if we did, it'd be
It'd be
great.
nice.
So,
I wanted to apply for that grant.
right, it's a
I know, that would be
lot.
very nice.
It's more like a $5,000 grant, and they go, you should be happy. It's $5,000, come on.
We have other cost savings with software that won't show up in the contract, so as we purchased, I think Geauga, we purchased a $200,000 software that had a lot of maintenance fees, which we
Yeah, there we go.
avoided. We got refunded by the local public health service collaborative for the
Oh,
billing.
okay.
We received $15,000 back. That was in limbo for 2 years.
Yeah.
So, you know, 13,000 doesn't sound like a lot, but there's a lot of other
It adds
efficiencies
up.
we need to quantify and present to the board.
We,
at this
and we
point.
will have, so in there, legal fees are one thing that's also estimated, they're based on what we're using right now, that could go higher, could go lower. There's also some IT costs in there, right?
Yes.
We did,
I was betting there.
right, we did get, all of our new IT will actually be in mostly this year, we still have some upgrades next year. We did one thing different this year, I had IT give us a range of like what monitors were acceptable and what computers were, and we let the staff have some options on what they wanted. Ironically, most of the things they're giving us were 15-inch laptops, we went with 13-inch detachables, because most of the staff are taking them out in the field, and they don't wanna carry a 400-pound
Right.
laptop. So that's went really well, that's, a lot of staff are like, hey, you are listening to things that we are interested in, you're not just saying, hey, take it and deal with it, because, you know, someone doesn't leave the office very often. So, we are upgrading things that we need to, most of our laptops for 2014, 18, and 2020, so we're getting all those updated, so.
Okay. Is there anything you want to project about the budget, or? No.
The biggest thing in there, honestly, besides, we already talked about, is just O&M. We are rolling O&M out quicker, or faster than slower. We're doing it at a reasonable pace though, but the reality is, you know, every budget we've had has projected something for that revenue. We are rolling that out. The other reality is, there was a valid concern raised by a citizen, which we had already thought about, and that was, if I'm in Group A and I start paying this year, and Group B doesn't pay till 7 years later, did I get screwed? And we said, well, we're doing a 5-year cycle, everyone will get into this within 5 years. That puts some minds at ease that this isn't gonna be like, you know, Chester and Chardon are 2023 or 2024 really, and then somebody else is 2090. You know, this is like, hey, we do have a plan, this will be in place. There's still some frustrations with it, and there was also some falsehoods claimed significantly on how this works, and that it's not mandated. And I actually did talk to one of our state reps, Ms. Breaky, actually kind of there.
Yeah.
I talked to one of the state reps yesterday, actually gave her some Ohio Revised Code sections and OAC sections, administrative code sections, to go over, and then I'm hopefully gonna meet with her, and then possibly another one soon to go over that and see if there are things that we can help with or change. Because it's a monstrosity of a program. It's mandated and unfunded. And we know one county, which I mentioned actually, Ms. Breaky, we know one county that has tried rolling this out 4 times now. So imagine being the homeowner, you get a thing saying, this is your new program, and a year later, this is your new program, and a year later. And they've actually come to us and said, Mr. Lark and his team have been like, how are you doing it? How did you roll out twice now? Can you show us how to do it? And so now we have people at different counties asking us, how do you roll this out in a timely manner that doesn't just piss everybody off, honestly. So, yeah.
What was tough is to find the agreement they had. I mean, otherwise sewage laws were like 1975. 2010 and 12, they were still debating about what it's going to look like. So when this finally landed, it's like, okay, everybody's hands off. So it'll be hard to change and push, because it's the best out of like 2 decades of discussion, the wetland where it's at, unfortunately.
Okay.
No.
So is there a motion to approve the 2025 Geauga Public Health budget?
So moved.
Second,
Ready to
Roll
roll call?
call? Yeah.
What's your favorite thing today? Dr. Henderson,
yes.
Dr. Rude,
Yes.
Ms. Roman,
Yes.
Ms. Jones,
Yes.
Ms. Breaky.
Yes. All right, motion carries. So we'll move on to the, overdose and suicide review committee.
Yeah, so this is just permission to ask the county commissioners to request to establish a hybrid drug overdose and suicide prevention committee, or suicide review committee. And that's something we take to them and just say, you guys have asked and we're going to ask them to do it.
Okay. And you would present that to them, you just try to get on the schedule whenever you can.
Yeah, Mr.
Yeah.
Graham and I would,
Yeah,
he's more in depth on this
process
one.
and
Yeah.
policy around it, because we would hand that to them and say, okay, here's what we hope to support. We'd have a discussion before it gets there, that way
Right.
we're not.
I'm not
on the
gonna
same
blindside
page.
him with it.
Yeah, exactly.
And so this, would be separate from Lake County's,
Yes.
committee.
I believe so.
Yeah, the data's totally separate, so it wouldn't make any sense to
Yeah.
do
Right,
that.
we have-
okay,
yeah.
that was,
I mean,
yeah.
we may be the common element, but we have, add this board, you have two different directors, two different philosophies too, as well as systems of treatment.
Should be easy to work with though, because the admin board's
Yeah.
new person was the second command at Lake Counties, so they kind of know each other, so it's
Okay.
not, they all know the same data and things like that.
Okay.
Okay. And then how are we selecting people for the committee?
We'll bring it to the board once it's created, but basically I have to chair it, and then there's certain mandated members, and then you can extend to a limited point others beyond that.
Yeah.
Board members or whatever.
So is it like someone from the sheriff's office or? is
It
that-
could, yeah, it could be.
Okay.
Yeah, I mean, I would think you would need clinical, law enforcement,
Yeah, the
members of
hospital.
the public, like, would be, somebody
Because
who's
the
been
members
affected
usually
by
don't, because
of
overdose would be a
Privacy
big
of
part.
it, but yeah, that's what we
Yeah.
have to put in place, who's able to, who's not, what side of the form you gotta
Right.
sign, confidentiality, immunity,
Correct.
those kind of things.
Yeah,
Do you have one in
advocacy.
Lake County?
We did several years back, we had a hard time getting data prior to this law, which is more concrete.
Mhm.
So a lot of people were like, we don't wanna share that information, so we're not coming to the
Yeah.
party.
Yeah,
And then you couldn't review anything, there's big gaps in the data, especially,
Mhm.
mental health, so this has helped
Yeah.
concrete and.
So you're
after
putting one up
COVID.
in Lake County too?
Yes, yeah,
Okay.
our board approved
Awesome.
it, Monday.
Monday, okay.
awesome, okay.
Thank you.
Alright, so is there a motion to request that commissioners establish a hybrid drug overdose and suicide review committee?
So moved.
I second.
Motion by Dr. Jones, second by Dr. Hendrickson.
Do yeas and nays.
All in favor?
Aye.
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 Opposed? Abstentions? Motion carries.
Thank you.
So now we gotta approve the credit card policy. Adam, you wanna talk about
Yeah,
that?
so, one thing Geauga has not had in the past is a credit card, there was a purchasing card, and if something was an emergency purchase, that usually be, I would buy it, and then I would get reimbursed. We do have, to make things easier now that we're, just keep things separate, we do have a Geauga Public Health credit card that we can use. We don't spend much on these, and that's why we don't really have our own in the past. But this would be for like hotels, they don't deal with checks anymore, and it's hard to tell someone, go to this conference and pay $900 on your credit card and then get paid back a month from now when we get a check to you. It is not an easy thing to do. Also, the credit, the state sales tax exemptions are hard to do when you're doing it as a private citizen because it doesn't look like you're really there for government business.
Yeah.
So we have this card, it has its own, it'll have its own credit card statement that we'll be able to present to you guys every month to go over.
Okay.
The policy that I sent out to you has some ability for all of you to kind of weigh in on it and say like, hey, we don't agree with this kind of purchase, please don't do it in the future. And generally, we only use it if I view it as a distinct need for the health part. It's not something we just go out and go, oh, hey, let's go buy some tchotchkes and whatever.
Yeah.
The other benefit of this is there are certain companies, like some of the vaccine companies, they will not deal with checks anymore. They're credit card only. And our one Qualtrics, I think is what it was, a program we used, was $1,800. I would pay for that out of my own money and then get reimbursed.
Yeah.
It's hard to float $2,000. Because if somebody doesn't pay me, I gotta pay interest.
Yeah.
So we do have those things. Again, you guys would get the statement every month. You can review it. It was approved by the, when I say approved, it's a carbon copy of one more or less that was approved by the state auditors in the past. It meets all their criteria. We also presented it to them last week when they finished our audit, and they said it met all the criteria of the state. It had all the correct wording in it. So if we're good with that, there was one change I've made to it, and I think Ms. Rowan brought to my attention, where it says like, administrator designee in a spot that probably would have just been myself and not, or designee. So I'll cross that out. We don't put names in there because if I disappear tomorrow, we don't want to hold up everything
Yeah,
because
have to
someone disappears.
reevaluate policy.
Yeah.
Right.
So
Well, don't disappear tomorrow.
Yeah,
Whatever.
please don't.
Awesome.
if somebody makes me disappear, I didn't intend to do it.
Alright, noted. I like that conspiracy theory. Is there
I had to throw it in.
a motion to approve the GPH credit card policy?
So
So
moved. Oh, I got it.
Who wants it?
Charles did it.
Alright, let's go Dr. Jones, second
Alright.
by Dr. Hendrickson? Is
I
that Dr.?
second.
Okay.
Thank you, Roman.
All in favor?
Aye.
Aye. Opposed? Abstention? Alright guys, welcome to the early aughts with your credit card policy. Motion carries.
Welcome to modern day.
Yeah, Dr. Rude will get the next one, he was eager to vote a yes on that one.
We'll put it in the trophy case, so.
Yeah, alright, let's
Be
go.
honored.
WPC.
Yeah, so the next one, when we have to sign the Water Pollution Control Loan Fund Agreement every year, it's usually Health Commissioner designee. We just wanna solidify that with you, that I can sign that, 'cause usually I do sign as designee, and I have signed it, I think, for 2 or 3 years now, but it's just something we wanna put in case they ever ask us, we have a, quantifiable issue resolution saying Adam can sign.
Okay, so is there a motion to accept the resolution authorizing Adam Lickey, administrator, to apply for, accept, and enter into a water pollution control loan fund agreement on behalf of Geauga Public Health of Geauga County for the repair and replacement of home sewage treatment systems?
So
So
moved.
move, or second.
All right, so moved by Dr. Rude, second by Dr. Hendrickson, and this
Got in the win.
looks like we should roll call vote this?
Yeah, we can roll up. Dr.
Where's
Henderson?
this one?
Yes.
Dr. Rude?
Yes.
Ms. Roman?
Yes.
Ms. Jones?
Abstain.
Ms. Breaky?
Yes. So wait, who moved for that one, Dr. Rude?
Yep.
And then Hendrickson.
Okay.
He was eager on that one, man, eager to be
All
here.
right.
Edge of the seat with the buzzer.
I like the leadership displayed on the Board of Health.
Nice shot.
All right.
He's gonna throw a name tag if somebody's gonna call him pretty soon.
So it's gonna be like,
So raising his hand.
We should get the buzzers, like Family Feud.
Okay.
Lights up above you.
Thing to sign going down. Okay, resolution to create certain fees for O and M.
So those are, I think those went out to everybody, the fees themselves. Those are just to create the ones that we already talked about. This is just the first reading. We do have a meeting coming up where the public can ask questions. And then they can be changed if something comes up. Like last time, we actually did change one of them because after discussing a member of the public, they brought up a valid point that we hadn't considered at that time, and we changed that fee as necessary. We still will have one of the lowest fees in the state, if not the lowest, when you compare all the apples to apples. So we just have to have just a vote on the first reading.
Okay, so is there a motion to accept the resolution to create certain fees, operation and maintenance program, first reading?
So moved.
Yes, second.
First by Dr. Rude, second by Dr. Hendrickson, and do we need a roll call or is this?
Yeah, do roll call because we have to separate out.
Okay, let's do it. Roll call vote.
Dr. Henderson?
Yes.
Dr. Root?
Yes.
Ms. Roman?
Yes.
Ms. Jones?
abstain.
Ms. Brady?
Yes. Okay.
There's also, was publication, correct, Adam?
What's that?
That's publication as well.
Yeah, we do publication and then we have to, I think it's within 30 days that they have, it has to be 30 days before now, which we did, and then we'll have the public comment as well.
Yeah, we got it.
All right, cyber air, what's going on?
So this is one that I bring up not because I want to, but because we have to. There, if you remember correctly, or remember a while back, there were 2 systems that went in. We made a non-binding, non-precedent-setting agreement that we were gonna offset their new permit, because they're putting a new system in relatively soon after the old system had failure. They are a known issue for the most part, that system. They're state approved though, so I want to be careful if I'm saying I'm not downplaying, it's just state approved. We've had additional people coming up to us asking for theirs. Now, some of these are even up, I want to say almost like 15 years ago was one of them. It was not precedent setting. I don't know how many exactly we would have, how often they would come up. And to my knowledge, these were not like recent replacements, they were older replacements. Does the board want to entertain those? Does the board want to, case by case? I don't know where you want to go, and I don't want to step on your toes by telling someone that the board has said something they didn't say. So I'm just looking for input.
I mean, I think it should be a case by case. I mean, I had a lot of sympathy to the folks that came before us before, because I think all of those were very new systems that failed. And I guess I have less sympathy for a system that's been working fine for a longer period of time, but I don't, what do other folks feel? I mean, it's unfortunate we kind of set that precedent.
I don't think we set that precedent.
Well, we said it was.
I think some people
I think
felt.
They're viewing it
But
as
yeah,
a precedent.
I
Yeah.
understand that.
Yeah,
but
no, your point's well taken, Dr. Rude.
But I share your point that there was a reason why we
Yeah.
felt particularly moved by the person who had that recent occurrence.
Yeah,
I think the farther we go back, the
Right.
less sympathetic I am, especially since we are stewards of the budget and our limited resources that we have
Yeah.
to be Mr. Nice Guy.
yeah, and I mean, there's work that goes into approving those systems, right? So it's not like this is just money we're taking and, you know, there's not work being done in return. So there is a loss, and then that loss would be, you know, spread over all taxpayers, every time we don't take those fees.
So we can bring them to you as a case-by-case basis if we find something. It's really one or two gentlemen right now who have come up to us. I just have been non-committal in terms of, I'm not the Board of Health. I can't
Right.
speak for all of you. I can't make a decision for all of you. I can't just refund money as willy-nilly, because that would put me in a spot where maybe you don't agree with what I refunded. So,
But
we
I,
don't.
but I think I trust you in understanding that we're looking for something that makes it an extenuating circumstance that would bring it
I would
to our
agree.
attention.
Yeah,
We're not going to be in a mass approval, disapproval mode for every person who brings this issue forward, because
Agree.
we did not and are not setting a precedent.
Correct.
Yeah, I think the last discussion you guys were more like, you know, cut with a scalpel, not an axe kind of concept, and
Yeah.
make sure if you looked at everything, block anybody out that may not have been that minimal.
okay.
All right.
Citizens' remarks.
I only have one maybe from Ms. Gale here. So, Ms. Gale, would you like to speak? No?
I didn't have any questions.
Okay. Look, so we did such a good job. You didn't even have any questions.
Anyone change their mind? So you had a sign in?
Yeah, I was actually gonna ask Howard and the lovely power couple in the back.
Yeah.
Howard, any comments? No? Power couple?
Pass here.
Pass here. Our resident student who is so excited to be here.
We're having a lot of fun.
I'm like,
She's still awake.
Just one.
Okay, we'll take that. We'll take
I'll
that.
sign
I
it.
like it, I like the straight smile. Fun.
You're smiling my way.
That's so funny.
no public comment.
All right, no public comment. So I'm gonna make a motion to go into executive session for the purchase of property and for imminent litigation. So we will be inviting Mr. Graham, Mr. Licky, and our counsel, Mr. Pastura, into executive session, and then no action is expected when we come out. So I do need a second.
Second.
Second by Ms. Roman, and let's do a roll call vote.
Dr. Henderson,
Yes.
Dr. Root,
Yes.
Ms. Roman,
Yes.
Ms. Jones.
Yes.
Ms. Brakey.
Yes.
All right, before we go to executive, I do need a picture of all of you for the annual report. If we stand up against the back wall here, I'll try to get that. There's really not a great spot.
I'll get out of your way, my friends.
It's not really just like a plain wall.
Maybe we go by the flags.
Yeah, let's go in the corner. I'm trying the TVs out here.
Well, yeah, which flag?
Yeah, sorry, I was looking, yeah, that's the American flag.
Thank you, everybody.
Picture guys, Board of Health. Let's go.
Need something good for the. All right, everybody